In America, wealth pretty much equals health, and that's true for me as it is true for, the poorest person in the quote-unquote inner city. There's a gradient, and all the way along the way you can find yourself somewhere along that gradient. It's not like you're poor and you have bad health and then you're not poor and you have good health. For each step along that wealth gradient, you have a corresponding step of health.
I see money.
When you're a new immigrant, the relationship between wealth and health is relatively loose. As you become more American, that relationship becomes tighter and tighter and tighter.
After only 5 years in the U.S., Latino immigrants are 1.5 times more likely to have high blood pressure than when they first arrived, and to be obese. Rates of heart disease and diabetes also increase. More than 20% of Latino households are poor. The longer they're here, the more immigrant families struggle with discrimination, low-paying jobs, bad schools, and bad housing.
And if that environment is giving you cues that you're not valuable, that you have very little prospect for a good future, that starts to build up and you internalize that devaluation.